am Dr. T. Jaisakar, Faculty of Statistics, Maharashtra University, Trichy. Now, in this session, I explain Weibull accelerated failure time model for oral cavity cancer data.
This model is based on the survival analysis. Survival analysis is the core part of medical statistics. Survival analysis is the branch of statistics which deals with the collection of data, modeling, and statistical analysis for lifetime on units. A variety of technique for analyzing positive valued random variables. The value of random variable is the time to the failure of a physical component and the time to the death of a biological unit. The primary interest in the study of lifetimes in clinical and other experimental inquiries, measurements on characteristics. Such characteristics are called concomitant or explanatory variables which possibly have influence on lifetime. For example, many medical charts contain a large number of patients' characteristics, that is value of covariates, which are possibly related to the prognosis. This figure shows that different models of survival analysis. Survival analysis, three different major models: parametric, non-parametric, and semi-parametric models. In parametric models, logistic accelerated failure time model. This is based on gamma, exponential, Weibull, and other distributions. In non-parametric model, life tables and Kaplan-Meier estimators. In Cox-PH model is the semi-parametric models. In this research work to study the Weibull accelerated failure time model for oral cavity cancer data and its robust nature, to find the correct parametric model with closely approximate the results for when the true distribution is unknown or in question, to deal with the relationship between two different variables, that is dependent or response variable y and independent or covariates of x. In oral cavity cancer is an important cancer globally and is one of the 10 most frequent cancer worldwide. Oral cavity cancers form the third most common cancers among men in South India. Tobacco smoking and chewing are almost certainly the major preventable causes of cancer today. Cancer of the oral cavity together are classified: lip cancer, tongue cancer, gum cancer, floor of mouth, hard palate, and retromolar area. This figure shows the different patients affected oral cavity cancer. These patients frequently used tobacco keep inside the mouth. So long period these persons used tobaccos. So in face, especially mouth side, inside, outside, outer side of the face, infected the oral cavity cancer. In this survival analysis, censoring is the very important portion of calculation of analysis. In survival analysis, the observations are lifetimes which can be indefinitely long. So quite often the experiment is so designed that the time required for collecting the data is reduced. Two types of experiment to reduce the time taken for completing the study. Different type of censoring: type 1 censoring, type 2 censoring, random censoring. In this analysis, we will use the random censoring. This is based on patient 1 entered the study at time t equal to 0 and died at t1 to give an uncensored observation. In patient 2 entered the study and by the end of the study he has still alive, resulting in a censored observation t2 plus. In patient 3 entered in the study and was lost to follow-up before the end of the study to give another censored observation t3 plus. With random censoring, we will make the crucial assumption that time and censoring are independent. It seems justified with random entries to the study and randomly occurring losses to follow. However, if the reason for dropping out is related to the course of therapy, there may be dependence between time and censoring. In this Weibull accelerated failure model, based on the Weibull distribution with the scale parameter lambda and delta, and this model is based on the hazard function. The survival time under the proportional hazard model have Weibull distribution, while those under the accelerated failure time model have a Weibull distribution. The demographic and hospitalization data based on this analysis: age, sex, marital status, educational level, clinical extent of disease, type of treatment given, vital statistics, vital status, and survival duration. In this analysis, 3 years data describing hospitalization experiences were captured and collected for 2,581 oral cavity cancer patients data collected from Adayar Cancer Institute at Chennai. This is the data value labels. This is the analysis of Weibull accelerated failure time model based on the intercept, age, sex, marital status, education, clinical extent of disease, type of treatment given, scale, and shape. This is based on the probability with the chi-square test, estimate the beta value, and calculated the standard error. All these based on the 95% confidence interval limit. The finding of this analysis of the covariates, age, clinical extent of disease, and type of treatment given are found to have impact in the survival rate of the patients. So these factors are suggested as the covariates for estimating the survival rate of oral cancer patients. The covariates sex, marital status, mother tongue, religion, and education are found to have no impact in survival rate of these patients. So these variables may advise to be excluded in the future studies. In this analysis, random censoring capabilities and the baseline option is a powerful tool for handling early departure causing incomplete data for subjects during the study period. The Weibull accelerated failure time model is also useful for identifying the covariates for estimating vital status of the oral cavity cancer patients. The influence factors of the response variable, vital status factors of covariates are age, clinical extent of disease, type of treatment given. These influence factors are considered for independent variables in this model. The factors age, education, clinical extent of disease, and type of treatment given which are possibly related to the prognosis. Those who have the worst level of the disease have very lesser survival rate. Similarly, higher age group have less survival rate and the lower age group have more survival rate. The types of treatments are also having impact in the survival rate of the patients. Smile and everybody will smile at you. Remember, mouth expresses different type of emotions. Thank you.